Hey guys, this is me again. I'm just touching base with you regarding my surgery that I had on my Osgood-Schlatter syndrome and what happened to it. Basically, I had surgery a few days ago. I went to see my surgeon yesterday. He removed the pad with the ice pack built in and some other stuff, and they kept the tape on it because the sutures are still in. And it's a great thing about these sutures is that they're going to dissolve, so I don't have to go, have anxiety about getting sutures pulled out. The only thing I wasn't expecting with this was the fact that my patella tendon had to be repaired and a screw was used, and because it was pretty rough. But if you see from the last video, I had a lump right here. I don't know if you can see from a side view. It was a big nasty lump right here. All that has been gone. Taking it out, took out the osco and some fluid that was in there. My surgeon indicated he cleaned it out pretty good for me. And now the biggest thing now is I have some pain, and my range of motion isn't quite there. Interestingly enough, I can stand up on it, and if I just stand straight up, there's not a lot of pain. But when I use flexion, I have a lot of pain. If I go over a certain distance, then it's really a lot of pain. I have to get back on the ice. So I'm just trying to be careful and just make sure I don't do anything too quickly. There's a little bit of blood. They said it was going to be a little bit of blood, but overall it came out pretty well. I'm not going to have to worry about this daunting issue with this big knot on my knee anymore. Can't be active, can't play tennis, can't play basketball, long walks. I can't even work out because any extraneous exercise tend to cause me a lot of pain. And when that pain hits, I'm generally can't work for 3 or 4 days. And a couple of those days are I have no mobility. So I'm glad that's over. And I'll check back with you guys in a little bit so you'll know how things are going. Yeah, some of my skin stretched and it got kind of itchy, so I had to scratch it. But other than that, it's going pretty good. And I'm seeing a doctor in a week. And because of the screw, he's concerned about whether or not I'm going to need what's the term they're using? I can't even think of the term where they do the exercises on the knee. Physical therapy, I'm sorry. Yeah, so we'll know about physical therapy here, and hopefully I can get back to my normal day-to-day and get back to work. And but it's been an adventure. It's my knee is great, but when I try, this is where the knot was. If you can see it from an angle, you see it still has like a slight lift, but it's really soft, and the screw is somewhere in this area. And this is where the cut is, all the way across, all the way down. But this is going to go on over a few months. It should go back down and be the same as the other knee. But I'll keep you posted, let you guys know. So anyone who's going through this, I would tell them, based on my experience so far, get it done, because it usually happens to you when you're very young and your body tends to grow out of it. But as an adult, this is the only way. I mean, I've had injections and cortisone but it doesn't work. Let me tell you, it doesn't go anywhere. You're better for a moment, but if you're active, you have an active lifestyle, you like to do things, I would recommend this to anyone. But make sure you have the right surgeon. But it's been so good. Good so far. I'll check with you guys in a few days, let you know if any progress. So anyone's thinking about doing it, go ahead and get it done. A little bit sore, still have some time. I'll check back with you guys later.